Hello everyone, welcome to you all again to this masterclass of pharmacy practice for B.Pharm 7th semester. And today, ladies and gentlemen, we are going to discuss about the patient counseling and various steps involved in the patient counseling. So the patient counseling is typically one of the process in which you will understand the process and the various conditions in which we have to deal with the patient. We have to tell the patient particularly about the disease condition, food conditions, and storage of medications, administration of medications at various level. So this is one of the best thing you can do in your life as a pharmacist. When you are studying pharmacy, you need to understand that if you are going with this kind of application, you understand that patient is a very important person to get cured from any kind of disease. So in that context, particularly, we'll be learning today. So my sincere acknowledgement to the chairman, Shri Praveen Gargji, engineer Janesh Gargji, secretary ISFCP, and chairman TLF Global School Moga. Professor G.D. Gupta, sir, director cum principal, ISF College of Pharmacy, Moga. Professor R.K. Naran, sir, principal, ISF College of Pharmacy and Research. All HODs, dear students, and dear participants. So today we will see the patient counseling, and in the patient counseling, we need to understand that there is a patient and there is a counselor. So counselor is who? Counselor is one who takes care of the patient. So counselor needs to understand that if I wish to do the counseling, there should be some habits in me. And in that habits parts, we need to understand that the patient counseling is one of them. And in this particular concept, the goal of the therapy or the understanding of this exercise is that patient should be counseled in an effective manner. Counseling can be mass counseling, diet counseling, food counseling, and medicine related counseling, storage related counseling, precautions to be taken, directions to be followed, etc. Because once a patient is having a lot of queries in the mind. What is medicine? What is the chemical involved in the medicine? What kind of medicine will hurt in the body? Either the taste is different, what is the storage condition, how many time I have to take, what kind of consequences can happen with my sleep or my stomach or my mind, when I will get freeness from this illness. So this certain kind of questions roam around day and night until unless the incubation period is finished. So here we need to understand that the patient counseling is a biphasic process. Let us take one example of mass counseling. As you can understand, in the COVID-19 pandemic, our caller tune was changed with the Amitabh Bachchan voice and stating with all the precautions of the COVID during pandemic we have to take upon, like distance maintenance, use of sanitizer and physical distance, etc. So counseling can be mass, counseling can be one-to-one in Indian typical scenario. You have to sit with the patient, you have to be vocal with the patient. You should not use scientific words, you should use the regional words. And in that case, particularly, you can understand from that point of view. So this mass counseling or isolated counseling are the part of the scenario. So in this whole counseling process where you sit upon, you of the patient, you ask about the medicaments, you ask about the therapy, you ask about the process, you ask about each and everything whatsoever is required nowadays. So patient counseling, what is patient counseling in generalized, where you are advising to the patient, you are assisting to the patient, you are giving informations like how to administer the insulin, how to administer the meter dose inhaler, how to administer the medicines before food or after food, at what time the medicine should be taken up. So this all correlations comes up in your lifetime. Once you are ill or you are into the time of illness, you understand that what time I should refer to take the medications. So medicine should be administered on the daily basis, and this patient counseling refers particularly to the process of providing information, advice, and assistance to help patients use their medications appropriately. So in patient counseling, either pediatric or geriatric, old age, adult, wheresoever they required a skill of a pharmacist, patient counseling is required. So in patient counseling, you need to help patient with their medications appropriately. What are the objectives? The objectives are assessing the patient's understanding of the therapy, including proper use and adverse effects of the medications, improving patient adherence, motivating the patient to take an active role in health management, and particularly kind of problems like side effects, adverse effects, drug-drug interaction, drug-food interaction. First of all, you need to understand the psychology of a patient as a counselor. So what happens? Patients come with different ideology to your store. Let us take one example of an ill patient with psychiatry may not be having a stable mindset, or a patient with an irritable bowel syndrome may not be having patient to listen you properly. In that case, you should have a common patient information leaflet for both of those conditions, which he or she can take up with up the medicines in the box or in the polythene and can go to the home and read upon this instruction to use the medications or about the disease condition. Hence, this is approved that patient is a kind of entity in which the processing has to be done. Therefore, it is the requirement of the time to understand that patient is all, where we have to take care of pharmaceutical care, we have to take care of rationality, we have to give the medicines on the basis of the evidences, specifically in case of renally impaired, hepatic impaired, when the vision loss, hearing loss is there, or body surface area is less of the patient, or particularly when there is a psychiatric case. So in this particular cases, although one another case, special vulnerable population conditions is pediatric case, geriatric case, pregnant and lactating women, where the hormonal problem leads to, like if I talk about the blood pressure, is increased in that case, or the thyroid problems, thyroid disorders may worsen up in that case. So this all the things, and in particular chronic illness like tuberculosis and asthma cases, the patient medication adherence is one of the concern of the R. Individual must take care that we should motivate the patient to play an active role by self in the management of personalized care. So personalized medicine is given and personalized counseling is done, and several studies have demonstrated that patient counseling can improve the patient care in numerous ways. It reduces medication errors, it increases patients' understanding and management of the medical condition. It minimizes incidence of adverse drug reactions and drug-drug interactions, improving patient outcomes and satisfaction with care. There is a process of communication which includes sender, order, receiver. So we need to build the trust, we need to listen. Verbal communication, show sympathy, empathy, encouragement, we have to ask for the questions, non-verbal communications, etc. So what kind of process we adopt into the process is that certainly we need to understand at one point of time that what kind of workflow we do generalize in our manner. So sympathy and empathy encouragement is particularly knowing the patient, asking the open-ended questions like what is your name, where are you from, and how many family members are there. So in that case, the patient becomes vocal and talkative with you. So when his or her vocal is open, afterwards he listen to you properly, or will listen to you properly as a patient. And thereafter the verbal communication starts. So listening is also a part of communication, whereas the non-verbal and the verbal clues tells us about the patient's strategy and rhythmic process, that what kind of patient processing patient is in the requirement. So asking questions, non-verbal communications, this all are the parts. Pharmacists know about the medicines, drug-related problems, adverse effects, treatment plan, drug-drug interaction, drug-food interactions, and also minimize the medication errors, enhanced patient self-management by involving the patient in designing the therapeutic plan, potential for decreased healthcare cost due to appropriate use of medications and prevention of adverse events, effects of poor counseling, medication error, and there may be some problems like social stigma, adverse drug reactions, drug-drug interactions, poor adherence, and also therapeutic failure. So what are the steps involved into it? Understanding the patient, counseling the patient, dispensing cycle completement, patient reconciliation. Where what are the various points you have to tell to the patient? You have to tell about the medicine name. You have to tell about the medicine strength, doses, route, purpose, expected benefits of medications, how and when to take medications, adverse effects associated with the use of medications, precautions, contraindications, drug interactions, refilling informations, follow-ups, and any specific questions if the patients are having. So when you are doing a counseling as a counselor, you will be understanding the benefits where you can make a patient with less anxiety, stress relief, trauma resolution, better relationships, increased assertiveness, ability to set boundaries, trauma resolution, greater self-confidence, regaining emotional balance. So when a patient comes to you, he or she will be having a lot of questions about the storage, about the names of the medicines, about the time duration of the medicines, till what time we have to particularly use of the medications, etc. And in this case, you require the guidance and the counseling. And guidance is like as per the standard treatment guidelines, and counseling as per the requirement of the individual. And where we need to understand that in the counseling process, one individual who try to sit up and shares his or her problem with you, you should be very empathetic and sympathetic once individual. Then only you can use of the things. In this case, you have to use your brain. You should not put your brain for rest while doing counseling. Do not use many scientific words. Do not show the superiority complex that you understand that I know each and everything. No, you are patient. You need to understand first what is the gravity of the patient, what is the educational status of the patients, what kind of expectation a patient is looking for, what is the general appearance of the patient. Is a patient uneducated, illiterate? Is the patient agitated? Is the patient not trying to cope up? Is the patient is in bit hurry? Or is the patient want to tell something? Is the patient has been so much worried about the disease condition? So looking in several instances, we need to understand that we have to counsel the patient in such a way that information, advice, assistance is reached to the patients. So it's just like a butterfly effect with the patient diagnosis and the pharmacotherapy, where we are assessing the patient with symptoms, laboratory diagnosis, review of systems, as well as the complaints, imaging, pharmacotherapy, where we are looking at the cost, adherence, drug interaction, organ failure, lifestyle, this all the things. So patient counseling, where you are getting up with the recommendations, you are getting up with the exercises, aerobic exercises, physiotherapies, you are giving about the lifestyle changes, and you are also telling the patient that what to do, what about the illness, and provide individualized advice and information which will assist their medications, good communication skills, clinical communications. So as a pharmacist, you have to serve to the patient not only as a counselor but also as a patient helper, medication interviewer, health promoter, drug expert, and information provider. So when you do this, all the things all together, definitely your faith and process with the patient increases. So in effective patient counseling, better understanding of illness and patient, pharmacoeconomics, medication adherence, improved quality of life, reduction of medication errors, adverse effects are the part. You need to understand what are the patient you are going to deal with. Either a patient is having this prescriber response earlier in a positive or a negative way, or the counseling in the previous session has been went so far, kind of negativity or positivity have been concerned with the patient. Assess the patient situation, and in the patient situation we have to assess about the current situation, contemplate a tentative course of action, inquire into the patient's health status, state a recommendation, and into this recommendation particularly we need to ask about the status, provide information and proper medicine use, etc. The key points to recover during counseling: name, strength, doses, route of administration, purpose, expected benefits of the medication, how and when to take the medication, adverse effects associated with the use of medication, potential precautions, contraindications, drug-drug interaction, drug-food interactions, including OTC drugs, homeopathic drugs, proper storage guidelines, what to do if a dose is missed, refill information, and follow-up plans. Ask patients if they have any questions and concerns. Ask patients key questions to assess their understanding of their medication therapy. Encourage patients to call the pharmacy or physician if they have any questions or concerns, etc. Steps of patient counseling: preparing for the session, opening the session, counseling content, and closing the session, in which particularly all the aspects we need to understand the patient properly. If you are not able to understand the properly, that is why you are becoming a practitioner, medical practitioner or counselor. By coming a patient inside your room, you can understand that what kind of counseling and what level of counseling is desired or required for an individual. So in the steps of patient counseling, as you can see on this screen, beautifully written: goal and report setting. Assessment means diagnosis. Then what kind of treatment or therapy or psychotherapy or physiotherapy or therapeutic or non-pharmacological treatment. Intervention, evaluation, termination is required. So in the counseling steps, you can see report building, assessment, goal setting, intervention, evaluation, and termination is a part of this therapy. And then if I talk about the steps of patient's counseling, where it's a two-way communication. So first you should prepare yourself while going to ward round, knowing the patient, that what kind of the problems the patient is having, what is the patient history, what is the socio-demographic information, personal information, past medical history, past medication history, that etc. to be done. So in counseling process, success, guidance, counseling, analysis, assessment, everything is your part, where you need to understand that you are the one person who is responsible for the patient counseling. Guidance, counseling, assessment, analysis, all the things all together require. Because once you are doing a counseling of an individual, your mindset comes up first, that what kind of things you are gonna deliver. So this is what we see in generalized pattern, and in this pattern you come to a point that counseling an important segment. And counseling process, relationship building is very necessary part, and understanding a problem assessment, and then getting to set the goal that what kind of things I have to give to the individual patient. And from that, counseling interventions comes up. You can evaluate, terminate, or referral. So in this condition, steps like you should introduce yourself: good morning, good evening, afternoon, exchange of greetings, pleasantries, you calmly shout down. There should not be any noise pollution. Address the client by name. Invite a social conversation to reduce anxiety. Watch for non-verbal behavior as signs of client's emotional state. Invite client to describe his or her reason for coming to talk. Allow client time to respond. Indicate that you are interested in the persons. So in the patient counseling, assessment, reports, consultation, action plan all together work. Then opening the session, tell your name, you are a pharmacist, then tell you are going to talk about the illness, and you are going to particularly cure of the patient. In the counseling content, particularly you have to tell about the topic, medications, encouragement, non-directive, empathetic, non-judgmental, confidentiality of the patient should be maintained, and you should do the characteristics of effective counseling. possible medication or dietary interactions, advice on correct stage, minimum duration required to show therapeutic benefit, what to do if a dose is missed, special monitoring requirements, for example, blood testing. In counseling process, initial structure, rapport building, problem identification, exploration of self and perceptual field and behaviors, possible assessment and acquisition of environmental input, termination, follow-up, and possible development of additional strategies, plan of action, decision making, problem solving, etc. So information given and about the medicines, any specific category, narcotics, etc., to be taken off in a very specific way. And in the closing the session, you can remember what this medicine was for, how long you have to take, discharge counseling also you can do, and should be in the vernacular language. So this is how preparing opening counseling content, name, description, medication, reason why medicines are being given, and what is the correct way to take the medications, what kind of duration, frequency, benefits, possible adverse effects, possible medication or dietary interactions, objectives of patient counseling. Patient should recognize the importance of medications for his well-being, a working relationship and a foundation for continuous interaction and consultation should be established. Patients' understandings of strategy to deal with medication side effects and drug interactions should be improved, should ensure better patient compliance. So patient, again I am putting the slide, who is the patient, what condition or situation and it he is or she is, contemplate tentative course of action, inquire into the patient's health status, provide information on proper medicine use. So what are the various patients category where we are in the requirement of particular counseling? Asthmatic patients, diabetic patients, patient taking 4 or more prescribed medications, patients who are mentally ill, patients using appliances, epileptic patients, patients with skin complaints, patients misusing drugs, patients who are terminally ill. What are the steps during counseling? Preparing for session, opening the session, actual counseling session, and closing the session. And the method is WWHAM. Who, for, what symptom, how long symptoms have been present, any action taken already, and other medications used. So in the conclusion, I would like to say that you have to verify the patient's understanding by means of feedback, and you should give patients some patient information leaflets, and via from this patient information leaflets you can particularly take care of the patient. And to check out the effectivity of patient information leaflet, you can check the flash reading is FRE. There is a formula where the syllables and the pictograms are being used, and the score of it should be 60 or above. It is the effectivity of the counseling one. So this is what, and Dr. Abhishek have told me there is one question, and the question is by the Bikram Bini ji. Sir, जब patient polypharmacy ले रहा है और उनको डिफरेंशिएट करना मुश्किल हो तो काउंसलिंग के दौरान फार्मासिस्ट कैसे इंश्योर करे कि पेशेंट करेक्ट ड्रग रेजिमेंट फॉलो करे? तो विक्रम बेनी जी, पहले ये बात आ जाती है कि आपको मेडिकेशन अडेरेंस करना, यू हैव टू टेक द मेडिकेशन अडेरेंस. And if any patient is not following the medication adherence, you need to particularly give that you are mixing the therapy. You are mixing the therapy in polypharmacy, or you are taking more than 4 to 5 drugs. Suppose you are taking Ayurvedic, allopathic at one time. So drug interactions, drug food interactions, or drug excipient interaction will take. Ultimately, they will change the pharmacokinetic and pharmacodynamic profiling into the body. So in patient case, you need to understand that polypharmacy means 2 or more medications, 4 or 5 medications at a one time you are taking up. So they may react to each other and the problems starts. Okay. So one another question is there, and the question is, if the patient have been taking high risk medications and if he is getting confused during the counseling, so how the pharmacist can do the doses adjustment, and particularly in case. So let me tell you, if the patient is consuming high risk medications, we need to understand that the doses adjustment is done is basis on the functional of the body. And if any kind of function in the body, like if I say suppose renal impairment or any dialysis condition or anything where the function of the body is altered. In this case, Clark's formula, Drilling's formula, Young's formulas are applied and the doses adjustment is done, so that you can come to know to a point that yes, we can do. So the next questions, which is certainly, if any patient is suffering from any kind of ADR after the counseling, so what is the accountability of the patient? So, my dear Vikram Mini, as I have told you, if any kind of ADR is occurring, you have to report to the toll-free number to the PVPI or nearest ADR monitoring center. See, adverse drug reaction is not a consequence of patient counseling. Adverse drug reaction is a consequence of a medicine. If a medicine is not compatible with the body certainly will give a reaction. Okay, so certainly with patient counseling, in patient counseling, actually we are telling these things only, how to reduce the medication errors and adverse drug reactions. And what are the various drug reactions in particular, we need to understand. So this is all about this. And thank you so much, everyone. And if you have any questions, you can send to me personally also. And thank you so much, everyone, for joining today. And today we'll meet with a new topic. Thank you so much. Advance wishes for World Pharmacist Day. Thank you.